Yeah.
All right. So a very good evening to all of you. And I welcome Dr. Sameer Arbat, who is a very well-known pulmonologist. As you can see, he is... All right. So a very good evening to all of... I'm sorry. So as you can see that he is still in the hospital and, he is attending COVID patients and he's at work. So thank you very much, Dr. Sameer, for taking out time for us and joining us today. So I really appreciate you. He's handling hospitalized patients, and although he couldn't make time to be at a separate place, so he has agreed to, address our concerns right from the field where he's working. So Dr. Sameer Arbat, he is a pioneer of international interventional pulmonology in Central India. He is the first doctor to have Central India's only EBUS and cryotherapy setup. He has received many awards at national conferences and has many national and international publications to his name. He's the youngest international faculty to teach at WABIP Program. He has performed more than 800 interventional procedures. He's an established clinician, researcher, and teacher in the field of pulmonology and interventional pulmonology, with multiple publications and presentations on international platforms. Dr. Sameer has extensive academic training and professional experience from JNMC Wardha, KM Hospital, and Tata Memorial Cancer Center, Mumbai, and Ancona, Italy. So he's an internationally acclaimed pulmonologist, and we are very privileged to have Dr. Here. So we have a very, very, I would say, super expert who can answer all our questions on COVID. So the questions are also changing day by day. The scenario is changing day by day. I'm not going to take much time in formalities. Dr. Sameer, first of all, thank you very much for joining us. I'm going to let the audience ask a lot of questions as well. To introduce myself, I am Dr. Shishir Palsapure. I am a psychotherapist, life skills trainer, and I have been trained at the Albert Ellis Institute, New York, and Beck Institute, Philadelphia, in cognitive behavior therapy and rational emotive behavior therapy. I would be answering your questions about stress and your behaviors and public behavior, what's happening. And we both would be discussing overall scenario of COVID. If there is something that is out of our expertise, I would definitely give you references. But at the same time, there are so many things that we would like to discuss today. Dr. Sameer, do we have you here? Okay, so I request all of you to write down your questions in the chat box, and I will be happy to compile them at the end of this session and ask Dr. Sameer. Dr. Sameer, why has the number of infections surged so much? Why has the second wave come back or come in?
Yeah, so there are two parts to this question. Why has it happened and what has exactly happened? So I'm not sure if it should be called a second wave because if you see it maybe in Bombay or Delhi, so it's the third wave. If you see it in Italy, so it's the fourth wave. So I suppose when we talk about these waves, it's just better to call it a wave or a surge rather than first, second, third. Now, why has it happened is a very complex question because never before have we thought that understanding a disease is such a difficult task. So when we talk about COVID-19, it is basically mostly related to a subject called epidemiology, wherein people actually do their master's or PhD in understanding the spread of disease. Then there is some part to it which is virology, as in the study of viruses. So that is a completely different chapter. Third thing is immunology, as in which is the study of vaccines and how your body responds to certain disease. And fourth is obviously clinical science, which is we people as in doctors who are treating patients. So we give medication. Does it work? Does it not work? So this is a very complex situation wherein a lot of subjects are involved. And if I talk about epidemiology, the reason for increase in number of diseases or the reason for increased infection is related to, am I here? Can you see me?
Yes,
Yeah.
yes, I can see you. Yeah, go ahead.
Yeah, so when a virus infection spreads around, it is related to the change in weather, the change in humidity, the change in the number of people in a certain area, the migration of people, the number of people who are infected before, the number of people who are asymptomatic carriers. So people have thought of a lot of reasons, maybe because after the previous wave, we got a bit lax, we got a bit uh, we lost our guard basically, and then we started mingling around and all. Maybe that was the reason. But then there are cities you'll see where there have been a lot of protests, the farmer protest and all, but that's not where the surge has come. The surge has come to a city like Nagpur and all. So right now there is no answer to this question, and I think so it would take years to understand this.
Oh, amazing. So I think I that makes a lot of sense. An expert does not have a straight answer to this question, that there is one factor responsible for surge in the cases. So we need to understand that this is a complex issue, and holding one person responsible, or blaming people, or just anyone for that matter, is a little too much to say. I'm saying that people do contribute to it, and I'm going to talk about people's behavior as well, like as Dr. Sameer rightly mentioned.
Sir,
that we let our guards down.
I suppose the problem mostly is that people want an answer, and sometimes you don't have an answer. But just to want an answer, you end up blaming somebody that this is the reason why this is happening.
All right, yeah. So they figure out an answer by themselves, and they think that the answer is correct. And because there is some evidence to it, they think that the answer is the only answer. But the answer to this question, why has there been a resurgence of cases, is extremely complex, and do not believe any other answer, because there is no single answer to this. There are complex, a multitude of factors contributing to it, and there is evidence for and against every factor that we could talk about. Doctor, so do you mean to say that we can anticipate another wave of COVID infections?
Yes. So when we talk about the COVID disease, this is very much similar to any other viral infection like the influenza or the swine flu. So the thing about these viral diseases is obviously there is a waxing and waning, as in there's a surge and there's a fall. But eventually you need a majority of your population to have to develop immunity, is when the disease actually comes to a graph that it does not increase anymore. So we will witness another wave. I'm not sure when and how. Maybe some cities would never witness, some cities might witness. Maybe abruptly there might be some certain ecological and environmental changes that the virus might lose its virulence. But for the most plausible reason, we will see a wave.
All right, so we need to anticipate another wave. So not just this wave is going to go down and we need to be lax, we need to be careless about this, but we can anticipate another wave. So need to be, on guard, not necessarily anxious, but we need to be on guard for another wave of COVID as well. So when is this second wave likely to go down? When is this going to recede?
Yeah. So I suppose.
Yeah, you can carry on speaking. You're visible.
Yeah. Yeah, I suppose what you're talking is about Nagpur city, as in that's what you mean, because you're asking about
not
this
just Nagpur
wave.
city. I think we have the surge in Mumbai, Delhi as well, and I think all over India there are certain cities where this is.
So like if I tell you that Delhi is ahead of Nagpur right now, their surge was relatively before us, and now they are kind of a month ahead of us when it comes to this. Mumbai might be similar or slightly behind us. So these are very relatable ideas. Basically, like if you talk about US, there are certain states which have extremely high number of cases, and there are certain states where there are no cases. So mostly we have to talk about a certain geographical area when we say about a surge. So I am not very sure about what we saw last time, that the surge was lasting for period of 30 to 45 days. So that should be the same scenario now. But as you must have realized with my answers, that scientists usually depend on a similar scenario before, which I think is not a very great way to carry an assumption, but that's the best you can.
Right. So if it goes up, it will come down for sure. We do not know for sure when, but we can assume it might take around a month and a half to for the wave to rise and come down.
I think we are witnessing a fall in number of cases for sure.
Yeah. So in the last 2 days, we witnessed a little bit of fall in the cases. Now, what typically happens with a fall of cases, and what typically happens with introduction of new drugs or introduction of vaccines, is people get a sense of protection, and then what typically happened in India, I would say, that people started becoming more and more careless, and they assumed that the risk is low. So because they thought that, they are protected now because they already had COVID, or they have had the first shot of vaccine, or they had a second shot of vaccine, they assumed that they won't get infected. And any which way, they also assumed that the vaccines are around now, so it is okay to not wear the mask around with people. And this led to a surge in infections. Like a lot of asymptomatic carriers carried the infection to other people. So not only there is epidemiology, but also people's behavior. Like, psychology plays a huge role in spreading infection. I think the way people look at their risk, the way people look at their cost benefit of some behaviors like wearing a mask and not wearing a mask makes a lot of difference. So this is one reason why people became lax, and then they suddenly stopped wearing masks or reduced wearing masks and going out more often, and that has contributed to surge in infections. Do you think so?
Yeah, I think so. Yes. Now that I am having a session with a psychology expert, I suppose I should open it out more on this topic, because whenever I'm talking as a pulmonologist, I often say that there is a lot of behavioral pattern to be learned with this disease. Especially sometimes this is what decides the scientific outcome also.
Right.
Unfortunately, what we have seen is people tend to act on certain ideas when they have some negative emotions like fear. So if you tell somebody that if you do XYZ thing, if you don't do XYZ thing, you might land up, you might die. So that's when they follow it. But unfortunately, when you reassure them that, okay, you are fine now, is when they go careless. And we've seen a lot of variations in public behavior like this. There's also a very different behavioral pattern that I saw personally is everybody was so sure that let the vaccine come and we'll finish Corona, we'll finish COVID in a week's time, and let's not worry, let the vaccine come. And the day of the vaccine was here, most people wasted their time and energy on how the vaccine is not effective, which vaccine is to be taken. So it just feels like when you don't have it, you want it really bad, and when you get it, you have all the conspiracy theories. So yeah, there is a lot of psychology there.
Right. In fact, human beings do not like uncertainty. They like certainty about things. For instance, they want a certainty that the vaccine is definitely going to protect them from the infection fully for life. They also want a certainty that the vaccine will not have adverse effects. And this is precisely why, in search of search of certainty, we delay our decisions. And that precisely happens. Like, if we have a doubt on the vaccine, we are going to find evidence that supports this doubt, and then conspiracy theory or any other things that we are going to focus on, then that would delay our decision. So obviously, about the vaccines, I'm sure that I'm going to ask you questions about vaccines.
I have a question to you. I feel
Sure.
what you said is partly correct, but I see that people like to be unsettled. I agree. Some people have doubts for the vaccine because they came to know that the effectiveness is 80% or there are some side effects. But I know a lot of people, they just like certain amount of chaos or unsettlement, because when the disease was there, they were talking something else, and when the vaccine was there, they were talking something else. So I believe that thanks to social media, a lot of people express what I feel is sensational journalism inside them.
Absolutely.
So if I am on social media, if I'm in a group, and if my friends are talking about how they witnessed an accident last day or something, people are compelled to just forward a message that they have seen maybe a fire somewhere and all. People don't like to be left out. People don't like not being giving their opinion, and everybody wants to be a news reporter, as in people just want to forward the message, spread the message, even forget they don't check it. But it's not your job. You can just stay in a WhatsApp group, and that's it. You don't need to comment or forward every day. And yes, I know a lot of people, uh, people above the age of 50 or 60, I think so, they go to sleep after 50 forwards and they wake up with another 50 forward. It's just a compulsion to send. As in, some people, you check your WhatsApp chat and they're just forwards and forwards and forwards and forwards, and I'm sure those are sent to another 50 people.
Now, there is an interesting angle to this, Dr. Sameer. We call this as, there is a concept called as there is a physical immunity that we have, there is biological immunity that we have, that comprises of our immune system, that comprises of our blood and the white blood corpuscles and all the chemicals and all that more about. But there's something called as behavioral immunity. Now, in terms of evolution, as human beings evolved, let us say that, prehistoric times, we were tribal. We had different tribes, and every tribe would have a certain way of doing things. For instance, the certain way of cooking food or certain way of, behaviors that were accepted. And when, tribes used to migrate from one place to other, they came across each other. And when they mixed with each other or they met each other, they noticed that when we meet people from other tribes, we get some diseases. And then they did connect, spread of diseases to mixing with people who are not significantly like us. So the discrimination started there, that, you are significantly different from us. And that means that, there is some danger. And, that threat, that the way you look at people from other tribes actually saved us from diseases, right? And, whatever behaviors were associated with protecting your tribe are very similar at what we do today. So, forwarding a WhatsApp message has a very clear, I would say, an evolutionary basis of protecting the whole tribe from some kind of danger. So if I see danger, I want to let other people know that there is danger. So at the same time, hatred, or, some people are not, let us say, following a specific routine or following certain patterns of behavior that you do. Now, this person is picked up as someone who is violating the norms, and they are considered to be threat to the tribe, and therefore hatred spreads. Now, why does hatred spread? It also has evolutionary basis. Hatred stops you from meeting people, and this is interesting because stopping to meet people stops the spread of disease. So in a way, the hatred that we see today has probably let us into intending that I just don't want to meet people. I want to delete my social media account. I want to, get away from social media. I just want to get away from people. That's the general inclination we have. And that inclination could be helpful, but the hatred in itself is not necessary. So we need to understand that, like intellectual human beings, that we can still follow social distancing. I would not say social distancing, physical distancing, without socially, drifting apart from people in general. So we are intelligent people. You are going to tell us about how to protect yourself from COVID. I think we don't have to hate each other, but that is understandable in today's context in terms of evolution. Why are we hating each other? and why are we spreading information like fire? Obviously, there are fabricated information as well that gets paid, but in general, we're talking about people forwarding messages and people forwarding hate towards each other. This angle of human behavior must be understood. So, yeah, Dr. Sameer, I have another question for you. Is COVID going to be around like HIV?
Yeah, so I suppose this is a very amongst all the questions, this is a question that I am more sure about what might happen. So let's not talk about HIV because it's a completely different uh, family of diseases. If we say, if you're talking about staying around, so let's talk about something like swine flu, which did come as a surge. So the Spanish flu that we talk about, which lasted for 2 to 3 years, 1920, which actually killed half the population of the world. It came back again as swine flu in 2008, 2009. So that there are various similarities between swine flu and COVID. First is it spreads through nasal and oral secretion. So it spreads through without touch. It spreads just by coming in proximity, not in physical contact. So I'm just telling you what are the similarities. Secondly, there is something called asymptomatic carrier. Now, why does it matter that a disease has asymptomatic carrier or a certain disease does not have? So, the Ebola virus is a very deadly virus. It kills almost everybody who's infected.
Oops.
But there is no asymptomatic carrier.
Oh.
So, whenever the Ebola is seen in an African village, you just need to check for people who are getting symptoms and you need to start treating them. There's absolutely nobody who has Ebola but is not being seen. So contact tracing works perfectly. So that's why Ebola is very deadly, but it has always been contained either in a village or a area of say 100 or 150 kilometers. That's not the case with swine flu or even the coronavirus. You have people who are asymptomatic carriers, which means that they can spread disease and you don't know that people around you are already sick and spreading the disease. Then there is something called the period for which a person can be infective. That is an infectivity period. So there are various diseases wherein a person can be infective only for a very short time, like 1 or 2 days. So the probability of him spreading the disease is less. Coronavirus has a very peculiar combination of A, having asymptomatic carriers, B, having a infective period, which is say around 14 days. It is not that long that the person is actually sick and admitted in the hospital. It is not very short that if the person is at home within a day or two, he will not spread. It's actually a perfect balance of infecting more people, which is 14 days. And then comes the infectivity rate, as in how much it can infect. So what is understood is that one person can infect 4 to 5 people at a time with COVID. So all these reasons mean that COVID has a very different pattern compared to other diseases, but very similar to swine flu. So I'll just tell you what happened with swine flu. So there was a surge of swine flu in Bombay, Nagpur in 2014. Most of the ICU patients were being diagnosed as swine flu. They were having pneumonia, very much similar to COVID, and they were all requiring ventilatory support. And a lot of them were succumbing. They could not recover. Most people above the age of 60 actually died. And these number of cases increased, decreased. But eventually, what the world doesn't know, but what we see is that it came down to a level where we used to see 1 or 2 cases every week. So this is what we call is an endemic disease, as in it is limited to area, but it is continued. Quite possible by end of next year, we'll see that COVID is a part of routine diseases. Every week, some people are getting infected. Maybe they are having less symptoms, more symptoms, but there won't come a day that, okay, all COVID cases are over today. Maybe that would take 4 or 5 years.
Okay. So it is probably going to stay around, not very serious, but it probably could be
It won't be
endemic, right?
bothersome, but
It won't be
there won't come a day that 2021 10th January COVID is gonna get
It's going
over.
to get eradicated, like,
I think
smallpox
that's
was
the difference
eradicated.
between science and maybe magic or whatever beliefs what we say, because science does not act very weird. It takes
Yeah,
time.
it takes time. Yeah, but smallpox was eradicated, and I hope that it never comes back.
It took many years.
It took
The
many years.
vaccination drive actually went for 30 years for the disease to be eradicated.
Right.
That won't be the case with COVID, because flu went down with 2 to 3 years of vaccination. Similar
Right.
would be with COVID.
Mhm.
But yes, maybe after 3 4 years there won't be any COVID patients.
Wow. So it is so easy to pass judgment. And when I learn about these diseases more, I understand that it's so complex. So, to answer any question, like, we cannot pinpoint one factor. And that is very intriguing about COVID. And that's why we are all puzzled as well, because we can't put finger on one factor. So let me ask you a few practical questions that we all are facing on a day-to-day basis. Do oxygen concentrators really work? And what's your take on them?
Yeah. So I need to understand, what do you mean when you say oxygen concentrators?
There are portable oxygen concentrators, like we are getting WhatsApp forwards, like 5 liters per minute. This is something that an
Okay, yeah.
oxygen
So
generator.
yeah, I'll tell you the. I would like to classify these oxygen sources into medical and non-medical. So
Okay.
what was used regularly in hospitals was A, oxygen cylinders, B, centralized oxygen lines, as in the hospital has a supply of pipeline which is connected to one place in the basement or corner of the building where a huge cylinder is supplying oxygen. And third is something very similar to the cylinder, portable cylinder, which is a oxygen concentrator. So when we see about respiratory diseases, your lung functions, or the amount of your lungs affected by a certain disease, will define if you require 1 liter per minute, 2 liter per minute. When it goes up to 6 liter per minute is when you have to shift from nasal prongs to a mask. After 15 liters, the mask is not effective. So what comes after that is either a BiPAP, or maybe an HFNO, and then comes the ventilator. So these oxygen sources are medical oxygen sources, which is oxygen concentrator, oxygen cylinder, and centralized oxygen. So there is absolutely no sham or nothing bogus about these machines. These are what the hospitals use. Now the question is, there are some new things which are labeled as oxygen concentrators,
Okay.
and I'm not sure about if they work or not. I can tell you one thing for sure, that there are certain cans which come like a perfume
Yeah.
spray, or what the size that we get in a mosquito repellent spray or hit spray. They are 100% a good marketing strategy. They I don't think so that they are doing anything wrong, because they don't claim that it will save your life. They just say that it gives oxygen, and we believe that, okay, yeah, this will save my life. They should be banned. They should be banned, because unfortunately, I uh, I just feel very sorry. It just makes me feel very bad that I've had patients who have been at home, and they thought that they will survive because they had this can in front of them. I've seen elderly men in their 40s telling me that we are looking for a hospital bed, but right now we are secured because we have an oxygen cylinder. And I am telling the person that, okay, then you have a good period of 4 to 5 hours till you actually find a oxygen hospital bed. And when I ask them as to how much is the SpO2 level, and he says it's 60, and I'm saying, like, how come the oxygen level is 60 when you have an oxygen cylinder or concentrator? So that's when he sends me a picture, a WhatsApp picture of what he's using. And what he's using is a can which gives out oxygen, but eating
Right.
oxygen does not increase your level. You need a continuous supply of oxygen, which is
Right.
calibrated in a medical form. So that does not work. I'm not sure if that is called oxygen concentrator in the layman language or not.
No,
Another
these
thing is,
are
yes,
oxygen, yeah, sprays. Yeah. Mhm.
yeah, and another thing is there are various versions of it. See, whenever there's a panic, people like to make money out of it, and they do it in every way possible, shamelessly. Then there is another question which I would tell you is the oxygen concentrator works. It definitely works. There are types of oxygen concentrators: 5 liters, 7.5, 10. Uh, the problem with people spreading messages is the thing works, but you claim that it works for something way more than what it works for, and then people say that it's a fake or something. So oxygen concentrators work when they are with a doctor, with a hospital. I don't know when they go into common man's territory, what do they do with it? So then the question is, what are we talking about there?
Hmm. I understand. So, it is very important to use oxygen concentrators in medical supervision only,
See,
because the doctor is the right person.
I'll give you a very good example. Steam works very well to clear your nasal secretions. But if you say that steam works very well to get rid of cancer, so I'll say that steam does not work. So what are you claiming it for? And
Correct.
yes, people claim anything.
Right. That's true. So you need to be very, very careful about these things, not press the panic button, and always, always, always use such things under medical supervision, because, you're not the right person to make a
No, so
decision. Right.
we again come back to the second question that we had. So people feel that I'll forward this message and it might save someone's life,
Correct.
and the information is completely incorrect, fabricated, and yes, you get a 3 days fake news catastrophe.
Absolutely. So, forwarding a message is an extremely responsible act that we can do these days. Must be added with under medical supervision, or I have not verified the information and I do not know the veracity, or what it can claim to cure or to help with. Right. When to reach out to a hospital?
Yeah. So when to reach out to a hospital? This is a completely clinical question. This is a question which is cannot be determined by how you feel, what you feel. This is something completely determined by your clinical parameters. But yes, when we are seeing a pandemic, you might not have a doctor around every time to decide that yes, you should reach out to a hospital, which might happen with a disease such as asthma, or maybe cardiac events, because they happen very sporadically once in a year and all. Now that everybody is having COVID, although it's a clinical criteria, people should know when to reach to a hospital. This is what I tell all my patients on online consultation, that you should know this, because even if I'm not around, you should take the correct decision. So as of now, uh, when do you go to as in when do you get yourself hospitalized, as in when do you get admitted? So since we have a scarcity of beds in our city or in the country, so what is defined is, if your SpO2 levels have gone below 94, or your temperature stays 100 or above even after taking medication, or the third thing, that you are severely unwell, as in your SpO2 is fine, your temperature is fine, but you feel very restless, or you are in much discomfort, this is the time you need to get yourself hospitalized. And in certain cases, you are above the age of 60, you have n number of comorbidities, so you need not wait for the SpO2 to fall twice or thrice. You might get hospitalized the very first time. But again, this is all defined by which day or what time we are in, because in the month of December, if I see that a patient is in the age of 50 and his SpO2 is fine, he just had one spike of fever, I might get him admitted, because that time the beds were available. Now
Right.
that the beds are not available, we need to actually segregate people into the ones who require bed the most should be admitted, the ones who might require the bed but can wait for 5 days are started on uh, tablet therapy, which is Azithro, Fabiflu, and the ones who have mild symptoms are asked to not get admitted. So Right now, if you see in Delhi, unfortunately, even if you have all the symptoms and your SpO2 level is not below 90, they are not going to take you inside because they are having extremely shortage of beds. So as of now, you just need to check your SpO2 if it goes below 94, or your temperature is constantly touching 100, or there is some other reason because of which you are completely fatigued. You cannot walk. You cannot maybe get up from your chair. So that's the time when you should be hospitalized.
Right. So there are multiple red flags that you need to keep a watch on. Please keep your doctor updated because your family doctor knows your overall condition, your comorbidities, and it's a complex decision to make, but there are certain red flags that you may definitely want to report to your doctor. Doctor, when to do HRCT and how to interpret the score?
Yeah, so I think so. This is the most apt question for today's discussion because this is something that I have to give a lot of time explaining all my patients. It actually takes up most of my time. And okay, let's see. I'll tell you how the clinical presentation was last year when we had the surge, which was basically in Nagpur. It was in the month of August and September. So last year, what we saw was most people, if they are getting an HRCT done on the day of the first symptom or the second symptom, and their CT score is somewhere like 0 and 1, after 5 days of treatment, it might stay 0 or 1, or might just go to something called 2. Also, what we are seeing is if somebody on the first day of starting of treatment has had an HRCT score of 4 or 5, after 5 to 10 days of treatment, it was coming down to 1 or 0. So that time, the charting of HRCT was very much coinciding with the course of the disease, the course of the treatment, and the symptoms. Now I'll tell you what I've seen for the 1,000 patients that I've seen in the month of March and April. Most people who have an HRCT score of 0 or 1 on day 1 are having an HRCT score of 12 or 15 even after completing the treatment. This does not mean you should get your CT done later. You should not do it before. This is what is happening. It is still better that if you can get an HRCT done, do it on the very first day. Why? If the symptoms, if the CT score is going to go bad later, okay, you might get it done later. But if it has already gone bad, you are picking it up before. There is something very unnecessary that people actually cling on to is the HRCT score. Everybody is so obsessed with the HRCT score. So I'll tell you one thing. We are pulmonologists. It's our domain to understand the CT scan of the lung. So very often I see that the CT score has been mentioned as 14, but I feel that this is just a score of 4 or 5. At times, it is mentioned that the CT score is 1 or 2, but we can see that there's 70 to 80% involvement. So it should be a score of 14 and 15. This might be happening maybe because a lot of radiology centers have softwares which give a diagnosis.
Oops.
So that might be the reason. It might also be because a lot of radiology centers are overworked. They are doing 300 CT scans a day. So the reports are sent to a very remote location, maybe Bangalore and Delhi, and the person sitting there is giving the report. And it's not his fault, but when the number of cases increase, there are errors in reporting. Like I'll tell you, there is a limit to how much CT scans a radiologist should see in a day, because after that they get into fatigue, they get tired, they lose their actual precision to understand it. Last but not the least is something which only a pulmonologist understands best, is your CT score can be 15, but what you see is a regression of disease or the disease going down, and your CT score can be 5, and what you see is a big flare up. So for this, the best thing you can do is whenever you are done with your 11th and 12th, appear for the pre-medical exam, do your MBBS, then do your post-graduation in chest medicine, become a pulmonologist, and then you can tell, yes, this CT scan is bad and this is good.
All right.
Otherwise, it's not your subject.
So this is not an oversimplified answer. I am glad that you gave that. It's because, even HRCT poses you risk of radiation. So do not do HRCT unless advised by the doctor. Do not serially do HRCT just for the sake of it.
I'll tell you, it is not radiation, but it just makes you go crazy. So very often I see that my patient is completely treated. He has no symptoms. I'm very sure he or she does not require a CT scan. But somebody in the friend circle has said, oh, get a CT scan done. Then they get a CT scan done. Score comes to 15. I can see that it is a regression of disease. It's a healing picture on the CT scan. But this person goes crazy. Oh my God, my CT scan is 15. And then he ends up taking some few more medications. So I think so. COVID is all circus going on everywhere.
Right. So don't be your own doctor. Don't use the WhatsApp University. Do not use the Google Doctor as well. Please consult a proper pulmonologist or a medicine expert or intensivist. And these are the people who would be the right people to guide you and do as said. Sometimes we do take advice, but we do whatever we think is right.
I think all the time people do what they feel is right.
I understand, and that will only add to the stress. And because, it's very understandable. These are stressful times and we do not want to take chances. And that's why we want to do whatever can be done. And that's very understandable. But that's only going to be counterproductive. And, sometimes we will end up doing things that are irreversible. There are quite a few questions about vaccines. So I want to take a few questions about vaccines from the audience. Now, I recently contracted COVID. I would discourage people from telling personal cases, but I would recommend general questions, because every personal case needs proper evaluation. And, we will probably...
This is in your car, right?
Yeah, doctor is attending someone.
Yes. Yeah, I'm here.
Yeah. So
I'm looking for a charger, basically. I'm looking for a phone charger. Yeah.
Okay. So there's a question like, I recently contracted COVID. Do I need to take a vaccine soon, or should I allow others to take it first? Also, will I be a carrier of virus again and infect someone again? Until when am I immune for? So there are quite a few questions here.
I think it's a battery of questions in one question. So right now, if you have contracted COVID, as in your report says that you are positive and you are done with your treatment, so the consensus right now is that you have to wait for 40 days before you get your vaccine.
Okay.
So that's right now, that's the consensus. Quite possible in the coming few days or a week or something, WHO or the government or certain medical study might say that, okay, you can take a vaccine after 15 days, maybe after 45 days, 1 month, because COVID is a rapidly evolving situation. So there are new guidelines every time. But as of now, if you were COVID positive and you finished your treatment, wait for 40 days before you take your vaccine. This might be your first dose. This might be your second dose, that sort of thing.
All right. So would the person be a carrier of the virus after getting infected or after being vaccinated?
Very difficult to say, but for the most probability, once you are vaccinated, you should not be getting the disease and you should not be the carrier also. But you might be a carrier, but that is not because you took the vaccine. It might be because people are anyways carriers of this disease.
So does the vaccine protect you from getting infected, or does the vaccine only prevent death and serious disease?
Both.
Okay.
Answer is both of the above. So basically, how does a vaccine work? ABC. The A for how a vaccine works is it does not let you get the disease. So if you have taken the vaccine, there is a 70 to 80% chance that you would not contract the disease. That's the first thing. Second is, if you do contract the disease, there is a higher probability that your symptoms will be mild compared to what they could have been severe. So I'll give you a good example for this. We do take vaccine for tuberculosis, which is the BCG vaccine. We take vaccine for measles. We take vaccines for chickenpox, but we do get it. But there's a probability that if you're vaccinated, 70 to 80% chances you won't get it. The B situation is you do get chickenpox, TB, and measles. But there was a time when people used to die because of chickenpox or die because of measles. Now you get it and you are healed in a period of 15 to 20 days. So something similar stands for COVID. And the third and the most important part is your vaccination is not to protect you. It is for to protect the people around you. So when 70% of a population of a city or a country gets vaccinated, there are very few people left to spread the disease. This is obviously challenged by a reinfection or migration of people and various other scientific factors. But this is how a vaccine works. It's not 100% cure, but people often just hold on to 70 and 80, 70 and 80. It's like if you jump off a plane, one parachute might protect you 80%, one might protect you 70%. So the cynical person might say, oh, it does not protect me 100%. So why should I even open my parachute? Correct. That's one. That's most of the people. Why should I take a vaccine if it does not protect me? Let me fall off the plane and just break my bones and die. And then there are people who are often thinking about, should I use this parachute? Should I use that parachute? I've heard this is 70, that is 80, that 10% is such a big difference. I won't use this parachute. Just get yourself vaccinated. All the vaccines are good and they are all effective.
All right. So that stops me from asking the next question. All right. So when can we take the second shot?
So again, there is so much of variation. There are two vaccines that we have in India. Basically, one is the Covaxin, another is the Covishield. The difference is the Covaxin is an inactivated virus. What is injected in your body is a dead version of the virus, and your body's immune system now identifies this virus. It builds up immune response, and next time when you get infected, your body is already prepared. The Covishield is a very different concept. It is an adenovirus which is used as a vector or a vehicle to carry the spike protein of the coronavirus. Okay. So it's not the coronavirus, but the spike protein being sent inside you through the adenovirus, but it gives the same response, which is strong enough to build an immune response, but not strong enough to actually make you fall sick. So this is how these two vaccines work. The actual time between these two, the doses of these two vaccines differ from country to country because there's a difference of opinion in the scientific society. So if you're in the UK, they are saying take your first shot and delay your second shot for as long as possible, 3 months, 4 months, 6 months, 7 months. In India, we were told earlier to take the second shot after 28 days. Now they've turned it to somewhere around 45 days. Maybe with another month, this might change again. Whatever is the guideline, just follow it wherever you are. So as of now, if you have taken an Indian vaccine in India, 45 days, I think, is the period. The software generates a date for you.
All right. Okay. So you will get a notification, and if not, then 45 days is the answer. We have questions like, if I have allergic rhinitis, asthma, can I take vaccine? And there are other people who are asking if they have diabetes, if they have hypertension, or if they have fever, should they take vaccine? So under what are the contraindications for vaccine?
Yeah. So again, this is a very complex question. I'm telling you, the more questions you're asking, the more people will feel कि यार किसी को कुछ पता ही नहीं है, but that is the fact कि किसी को कुछ पता नहीं है. The vaccines have come with a guideline in India that if you have any allergic reactions, if you are allergic to certain medicines, if you are pregnant, if you are a lactating mother, you should not take this vaccine. Okay. Now the same vaccine has come in UK with a guideline that this can be taken during your pregnancy or if you're lactating. So there is a difference of opinion there. I had this question in my mind and I actually connected with Dr. Randeep Guleria, who's the director of AIMS, who's actually heading the Indian COVID fight. it was very nice of him that he actually replied to me, because I'm sure he has no clue who I am. What he said was, the vaccines are coming with a long list of instructions, which is often the case with any new thing. It comes with a list of infections. Do not do this, do not do this, do not this. This has been done just to make sure that we can avoid maximum adverse events.
Correct.
So there is a person who is supposed to give you the vaccine. He is called the vaccinator. That person is always a government employee, or now there are some private hospital people who are giving. They don't want that something happens wrong with you and it goes onto their head or their blame for it. That's why the guidelines have come with extreme precautions. But if you have allergic rhinitis, if you have allergies, which is, I suppose, 60% of the country, most of us won't get vaccinated. So it's a very tricky question. I would not ask you to break the rules, but a lot of us are not eligible for the vaccine because of these reasons. I don't have an answer.
All right, so it's a complex question, but there are certain absolute no-nos in
there are certain absolute no-nos which I suppose the people who have these diseases know from the start, because vaccine is not their first contraindication. They have a list of contraindications.
Correct. Right. All right. Okay, fine. So we get the answer for this. No, Abhilasha, it's not an absolute no for you. If you have allergic rhinitis, the best thing would be get yourself evaluated by a medical professional, and then but the risk of taking the vaccine is much lower than the risk of not taking the vaccine. So remember,
so like the number of people who have blood clots due to vaccine must be say 1 in 1,000 million. The number of people who might die because of vaccine must be 1 in a billion. The number of people who are dying because of COVID is actually 1% of the population. So don't waste your time understanding or imagining, or even if there has been a death because of the vaccine, which might be a fact, that is 1 death in billion. And the chances of you dying because of the disease is so more than dying because of the vaccine. So again, don't get carried away in WhatsApp messages. Do what is better for you.
And also there is something called as correlation and causation, because just because a person died after taking the vaccine does not mean that they died of the vaccine.
Most probably the person had a weak heart. He could have had an heart attack on a certain day. He took the vaccine 2 hours before on that day. So that's it.
Yeah. So then just because two things happen together does not mean that they are causing the other.
And there is a higher chance that that person must have taken a vaccine 4 days before or 4 days later. But the local newspaper found it very interesting and very juicy, and it is spread all over the country.
Right. I often give this example that, when a first grader goes to school, their teeth start falling. So first grade causes the teeth to fall. So that does not cause it. We could make a newspaper headline that, this first graders, went to the school.
I'll tell you something similar. I've always heard people who read your horoscope, basically Jyotish people, they'll often tell that you might end up meeting in an accident between the age of 16 and 18.
That's
and it does end up being true. Why? Because that is the time you start driving, and you might, or there's a fair chance you had an accident when you're 14, 13. But yes, probability says that this might happen. So first grader, getting into first grade leads to falling of teeth. Yes.
Falling of teeth. Yes. So we also retrospectively connect these two as causation, because they're just happening at the same time. Right. If one of the family members is infected, what the rest of the family should be doing?
Yeah, so there is no confusion over here. This is where I think the scientific community is most sure. This has been right from the day one. It has not changed. There has not been any alteration. So if a person is infected, he or she should completely isolate himself or herself from the people around, just to stop the spread of infection. So what do? If you are infected, you get a room for yourself in the house. Get your clothes for the next 14 days inside. Uh, make the room comfortable so that you can spend the whole day inside the room. Keep water handy. Keep some, maybe a TV or a music system sort of thing. And try not to step out of your room for the next 14 days. This is what is the theoretical answer. There are various practical limitations. India is a country which can never have um, home isolation for 70% of the population, because 70% of the homes in India don't have a ratio of one room per one person. So you have 6 people staying in a 2-bedroom flat or a 3-bedroom flat. So isolation is not possible, but theoretically, that's what you should do. There are certain limitations, like you need to step out certain times to help your family, or maybe just cross the pathway to the bathroom and all. There are a million reasons why you might step out of your room even when you are positive. So that's when you have to make sure you wear a mask, the person around you is also wearing a mask. um, at times, yes, there are a lot of mothers who are positive, but the kids are not ready to go to sleep without their mother and all, so they need to spend 10-15 minutes with their children. So make sure you are wearing a mask, they are wearing mask. Try that you are keeping a distance of 6 feet. So if there are 2 people who are involved in cooking, one of them is positive and needs to go to the kitchen, then the rest of them should stay more than 6 feet away. Everybody is wearing mask. I'm not giving you, as I should not be telling all this to you. I should be telling you stay inside a room. But I've treated so many patients, and it's practically impossible to stay inside a room.
Yeah, I totally understand. So is the second or the variant, or the second or third variant, I suppose, is it more infectious?
Yeah. So now let's talk about the variation. So people actually got frightened like anything when they heard that there's a mutation in the virus. So it feels like you're seeing a Steven Spielberg movie, and the alien has now suddenly mutated. Earlier it had 2 heads, and now there are 3 heads and a tail growing right up to your neck. So that's what mutation sounds to most of the people. It's a very scary horror movie formula. Virus in general are supposed to mutate. So again, very interesting fact, virus fall into a category of live and dead microorganisms.
True.
So they are live when they are with a host, otherwise they are dead. Whenever they are with a host, they tend to mutate, as in there are changes in their protein sequence. So consider that a virus is your suitcase luggage lock. And every few days, the combination keeps changing.
Okay.
Which does not happen with mammals, as in us humans, but that happens with viruses. It happens with us over a course of 1,000 to million years. So we have had mutations. We were a taller species before, more monkey-like, but now we are very different. But this has taken years to happen. Virus keeps on doing this at a very quicker rate. So the combination of your lock keeps on changing. So most of the flu viruses, again, I'm talking about the influenza virus and the swine flu virus and the COVID virus, because they are again somewhat similar. What we understand is they mutate every 3 to 6 months. So most probably the virus that was there in India in January was somewhat different from what we saw then in April, then in June and August and December. So this is a very common process of viruses, that they keep on mutating. When they mutate, they have a different protein sequence. So their clinical presentation changes. They either go more infective, less infective. Your body's response to it differs. So maybe the first time less people were dying, now more people are dying. So this keeps on happening. And it is this mutation only because of which the disease goes down and the virus loses its virulence. Now talking about the virus that we are seeing right now, yes, there is a big difference, but this all can be proved after a big control study of 10,000 people compared to last time. But I've seen this, that a lot of young people are getting infected now compared to the last time. Last time I saw that 80% of the people were elderly and 20% were youth. Now I see it's a good 50-50. A lot of youth is now infected. A lot of youth are now infected moderately and severe. Last time, most people in their 20s and 30s had a CT score of 0, as in a perfectly fine CT. Now, everybody in the age of 20 and 30 is having a bad CT either on the first day or fourth day. And this time we are seeing that it's mostly affecting men compared to women. But I cannot state this unless and until there is a controlled trial study compared at least in India, Italy, US, China. I'm just talking about a few 50 patients that are in front of me in my hospital.
All right. So thank you very much, Dr. Sameer, for all the answers that you have given to our questions. If the audience has any questions, please write them in the chat box. I'll be happy to ask them to Dr. Sameer. We have some questions from YouTube as well. If some people, after getting vaccine, get some symptoms and that does not settle with, and then get the antigen test done and it comes out to be positive. So is the antigen test positive because of vaccine?
Okay, so I would like to answer to this question by saying that last time when you took a car drive from your home to your office, and while you were driving, the right side of your tire was rotating in a certain way that the person next to your car could not read out what's written over there. But this time when you are driving back, he saw that, oh my God, it says Seat tires. Is it that your tire was slow, or is it that you're not wearing his spectacles that day? This is not your subject. Don't get involved in it. If you are taking a vaccine, there's a fair chance you will have fever, you will have symptoms for 2 to 4 days. Does the antigen test pick it up? Does not pick it up? Some people have actually given 30, 40, 50, 60 years of their life just to answer this question. Don't waste your time.
All right. What do women want? What do women want? Do you know the answer to this question?
No, I don't know.
All right. Even I don't. Okay. So let's not get into something which is not our subject, right? Okay. I understand some people do have concerns, but they're extremely specific questions, and I think the answers would be very complex. What does it mean if the fever returns after getting better for 3 days in COVID? Okay. Again, this is, very specific question to a patient. I would recommend that the patient needs to be evaluated by a doctor. There cannot be a blanket answer to this question. Is it recommended to get vaccinated even if a person has symptoms of infection?
No. If you have any symptoms, that's not the time to get vaccinated. If that's your day to get vaccinated, you should delay your vaccination. Right.
Okay. So these were my questions to you, Dr. Sameer, as a moderator, I would say, to a pulmonologist. Now, do you have any questions for me as a psychologist?
From my side?
Yes.
Yes. So I do have a lot of questions as a psychologist for you. The first one obviously is whenever a person is having COVID, he's actually suffering from COVID. So how much should he give importance to his mental health? And I believe that you should go for a counseling session after you've had a serious disease, because this is a once in a lifetime event. You might undermine it, but you should not. So what do you feel if somebody is COVID positive? Why should he or she connect with a therapist or get into sessions, or let's not call it therapy, because people feel that you're ill, you're psycho, so you need therapy. Let's say that counseling.
Assistance. Yeah, we can say assistance. See, COVID means different to everyone. For instance, COVID means very different to young people. COVID means very different to elderly people. COVID means different to middle-aged people. So what it means, if you are the breadwinner of the family, COVID means very different to you. If you are the dependent person in the family, COVID means differently to you. If you are the homemaker, COVID means differently to you. So COVID can just be a stressor to you, and it means differently to every person. So how everyone reacts to COVID makes a lot of difference. Now, because as you already mentioned, that this is once in a lifetime scenario, and some people are going to get traumatized by COVID and probably have flashbacks for the rest of their lives, or probably for a longer time. So it is important for you to react in a way which is adaptive. I often give the example of cactus. I mean, like, this is my uh, brand nowadays, that cactus has adapted itself to very harsh conditions, and as you said, human beings don't change. I hear it quite often from my spouse that I have changed. I think that's a different story. But human beings can adapt quickly to situations, to adversities. We don't have to take millions of years like a virus or probably a cactus. So we can change, we can adapt to situation faster. If there is an adversity, adapt to it. Now, the second wave, you need to adapt to it. Maybe another wave, you need to adapt to it. So first thing to understand is, how well adapted are you? If you can ask this question to yourself, and if you think that you're not being able to adapt as well as you would like to, if it is distressing to you, number one, it's getting on your nerves. If you think that this is too much for me now, I can't take it anymore. If you are having sleep disturbance, if you are having anxiety, if you are not eating well even after COVID is long gone, or if you are currently going through COVID, it always makes sense to learn few techniques from a trained psychotherapist. So to answer your question, when to approach a therapist, when you think that you could deal with it better, that's the time when you can approach a therapist.
So what are the symptoms of mental health of COVID? Like I, as a clinician, I can tell that if you have cough or fever or a running nose, or if you have loss of taste or smell, is most probably you should suspect that you are having COVID right now. So when should a person think of his mental health being affected by COVID? Because mental health is not easy to pick up. There are not parameters like, okay, my brain cells today are activated for 37%. I've gone below by 3%. Let's go to a counselor. I am telling you personally, I've most of our doctor colleagues, they often say now that they feel pukish when they have food, and they are completely lost, disoriented. And that's when we end up discussing that maybe this was happening to me also. This was happening to the third person next to us. And maybe this is happening for last 2-3 months, that sort of thing. Like, I'll tell you today that right now my eyes are kind of closing, and I am in between phasing out with this conversation. But that is now because I realized that for the past 3 days I've slept for only 1 hour in 24 hours. I'm now working in a new COVID unit, so it requires more thing. But mental health is not which is picked up this easily, and I felt that everything was going fine. But obviously today is the third day, and now I am kind of like I'll crash to sleep today.
I can understand. Right. Yeah. So there are no clear markers like we have physical markers, but certainly, people who have had COVID, or who are probably in the crisis, but
I think so. I think so. First of all, you having COVID is one problem leading to mental issues, but not having COVID, but the lockdown, the change in our lifestyle, things not happening like routine. I think that is more than actually getting the disease.
Right. Yeah. So there are many stressors in the whole scenario. Actual disease, a family member having the disease, or just lockdown, and losing, your income or probably work. So all could be stresses. So if, there are a few telltale signs of what we can say as your mental health is affected. The most common reactions we see today are anxiety, depression, and anger. So if you're feeling, if you think that you are being worrying for more time than what would be adequate, so that is called as unhealthy worries, and then probably you have anxiety. If you feel edgy, if you feel on the edge, restless for more than 15 days in a row, for most days of the week. Similarly, if you feel sad for most of the day, have lost interest in activities that you used to enjoy earlier, if you have sleep disturbance, if you have appetite disturbance, if there is a loss or gain of weight. So these are some telltale signs of anxiety and depression that need to be evaluated properly. So again, 15 days or more, if you have been consistently having things and your mood is off or probably worried or edgy, it is time to properly evaluate yourself. Or if you have been irritable and snapping out at people, then this is something that you need to get evaluated. Help is available. I have seen if people have had depression or anxiety in past, their depression and anxiety has been re-triggered, and it's pretty expected that a huge adversity like this can trigger depression and anxiety, but that's very, very treatable. Do not delay seeking treatment. It's readily treatable. And most therapists, I mean, a lot of therapists in the group as well, I think that they are also equipped to deal with COVID anxiety and depression and the mental health effects of COVID.
So there's a very big problem with mental health symptoms, that they are very slow and they like rise very slowly. So it does not happen that, okay, this guy was very cool till yesterday and today is very irritable. You start being irritable 1 day, 2 day, 1 month, 2 months, and after 6 months, you don't realize that there has been a big change, because that has been happening for the very long time. That happens with me when I lose sleep. It's not that there's one night that I am awake. Usually, then I find that, okay, this is how much I sleep. I just sleep for 2, 3 hours. But then I have to recollect that, okay, 6 months back I was sleeping very well, and now it's not the same. But usually it does not happen. There's also a very big barrier with mental health is which we have always seen कि जाने दे, टेंशन क्यों ले रहा है, ये कर ले, एज इन अरे आजा बैठ जा, मैं ठीक कर देता हूँ. I often give this example that if your father is having a heart attack, you won't go and say that इधर आओ मैं छाती दबा के ठीक कर देता हूँ. But people always say that somebody is about to commit suicide, just make sure that you are open for him, and you need to go to a therapist. You don't go to anybody. You are not anybody's therapist. As in, mental health is not treated by चल 5 मिनट थोड़ा घूम के आते ठीक हो जाएगा, sort of. That you agree that's the case?
Yes.
Many people have this Facebook update that I am available for you. You are not available. You have to take care of yourself. There is a therapist who needs to be counseled. You don't take responsibility for somebody who might commit suicide. It's a very big responsibility.
Correct. Yeah. Social buffers do matter, but when it comes to a disorder, motivational speakers and general public may not be able to help. So it is very important for you, people who are offering support, please continue to offer support, but make sure that you know that there are some telltale signs where professional help is required. Of course, I am not undermining the role of social buffers. It is very, very important, but that does not come to rescue when it comes to a disorder. And talking about symptoms, onset of symptoms, yes, many mental illnesses have a very slow onset, but there are quite a few who have a sudden onset. You can actually tell that 7 o'clock he started getting so irritable, and before that he was completely normal. So there are certain psychological, psychiatric disorders that have a very sudden onset of symptoms, and before that they are absolutely normal. So any change in routine behavior or your way of thinking or the way you feel could be an alarming sign. So change is something that we need to look at in mental health issues.
And last is, how much do you feel is the importance of mental health? I'm specifically saying this is because I often see that the patient who's come to most of the post-COVID patients who have recovered from COVID, they come to me with a worry like my cough is very severe, or most people have this worry, are my lungs fibrosis? There are a lot of fibrosis, but I can just make out that, okay, your lungs are fine, but you need counseling because you are behaviorally not fine. You seem to be depressed. You seem to be have had a very serious effect on yourself of the COVID admission in the hospital.
True.
But that's the last thing that anybody expresses to the person around him or to his doctor, because I think so mental health is often just not understood.
Absolutely. So I would say extremely important, because how the mental health is during and after COVID largely decides their behavior. And as you see, behavior, the way people are behaving has a huge impact on whether they're going to infect other people, or they are going to consume more resources. So it is pretty easy to actually screen for psychological problems. So I would suggest that people who are undergoing, COVID, or people who have had COVID, go through very simple screening of depression and anxiety. That is something that is most common to get triggered. And if you have had previous history of psychological challenges that you have had, it's always makes sense to revisit your psychologist or a psychiatrist. And talking about people's behavior, I think we must understand that there are some risky behaviors that people undertake. For instance, not wearing the masks, and there are quite a few explanations to that. But the most plausible explanation appears to be the effect where people think that they are now protected, and therefore they become complacent. And the second plausible explanation is people judge the risk ratio or the risk to themselves and other people based on their personal experience. Like, I have experienced this. I have not been wearing mask for last 1 year. Nothing happened to me. So they judge the risk based on their personal experience. They look at other people. They look at, their family members, and that's the mistake they are making.
So
And
that's why people who often perform stunts on bikes on a public street feel that मेरा accident नहीं हुआ है, तो obviously नहीं हुआ है, because हुआ रहता तो अभी तक आप hospital में रहते. So
correct.
That's a very wrong way to judge the risk ratio.
Right. And because they have gotten away with it for so long, they think that they will always be getting away with it.
Very contradictory to this is when our patients say कि इससे पहले तो कभी heart attack नहीं है.
Right.
तो इससे पहले नहीं आता है, हर चीज पहले बार ही आती है. So you can't say कि मुझे ये बीमारी नहीं है क्योंकि इससे पहले नहीं थी. तो आप क्या बचपन से एक सर्टिफिकेट लेके थे कि आपको बीमारी है? होता है. So I suppose that's also people saying कि इससे पहले नहीं था तो अभी कैसे होगा?
Right. I understand. I totally understand. And this is why it may not be a mental health issue, I would say, but it's definitely a behavioral problem. And, stopping the spread of virus is ridiculously simple. It's ridiculously simple. If we don't need lockdowns, if everyone wore masks around people for I don't know how much duration, but if everyone wore masks, the transmission, do you think, sir, that the transmission can be completely stopped if we are following simple measures?
Yeah, I think so. If we are wearing a mask, yeah, I'm telling you, if we are wearing our mask, if we are washing our hands regularly, and for the maximum possible ways, we are maintaining physical distancing, not social, but physical. I suppose everybody should know that it is called social distancing, but social distancing involves physical and mental and emotional. So we are talking here about physical distancing. I suppose if we do this, this is the highest probability of the disease going down. The reason I'm not saying that this will completely stop COVID is, again, it's a complex disease. There are environmental issues. Might be all of us follow these precautions, but there is a sudden fall in temperature, which leads to increased infectivity. So what we talk about is the highest probability. And I have learned a few things in this period of COVID. So last year, when I used to be giving a lot of TV interviews and newspaper articles about COVID, and also I used to feel a lot of anger towards people who are stepping out, maybe going to parties, people who are not following these restrictions, people who are traveling, people who are basically not acting according to the guideline. But now I understand that it's easy to blame somebody that, oh, you are going to the cafe, you are going out, but it's not easy to actually follow these guidelines to the T. I think so. If everybody follows these guidelines to the T, a lot of them would have depression before they have COVID. Because I have seen patients whom I say that don't go and meet out, but maybe that person has a very lonely job. He's anyways work at home. He has limited communication with his own family. So him meeting his friends once in a week and all is good for his health. Unfortunately, not good during COVID, but I don't feel we should stop them. I feel people have a lot of belief in God. Religion helps them stay positive. It helps them recover from disease. That's why they celebrate festivals. They go to the temples, they go to the masjid, but they should not go because it spreads disease. I think so. There is no absolute uh, do and don't do list. It is very easy to say that people should not do this, but there are reasons why they are doing it.
Correct.
Now I've realized one thing. Let's not get into fault finding. Let's start getting into the solution.
Right. Yeah, I totally agree with you. Sometimes some elderly family members, they are doing certain, they are consuming kadhas, they are doing certain rituals and something. And I would urge young people not to interfere with them unless they're dangerous. So if that's their way of coping, that's their way to get control over the situation. If they get a sense of control by doing certain things, please let them do it. So if they think that meeting people from a distance would be helpful, just don't stop them completely. So make sure that they are not doing anything dangerous. But otherwise, if you think that it's illogical, just plain illogical, just let them do it. Because people try to cope with the situation and adversity in their own ways. Encourage them to do something that gets them a sense of control, because almost everyone is feeling out of control. And we all do certain things that are just helping us to cope with it. So do something. For instance, wearing a mask is a simple thing that you can do to help yourself feel in control. So do things that are helpful. And sometimes just talking to friends, talking to your relatives on phone gives you a sense of control. Do it. Deleting your Facebook account gives you a sense of control. Do it. There is no harm in it. There is nothing illogical. Even if there is illogical, do it, because it helps you in the longer run. So thank you very much, Dr. Sameer, for joining us this evening. That was a very, very wholesome discussion that we had about COVID. I'm sure that many people have been benefited, and instead of looking at random places for advice, I think we all need to consult pulmonologists and doctors like Dr. Sameer. And for your mental health issues, you must consult a trained therapist. And this is where we come to your help. Like, we're always there, available.
Yeah,
For
I'll tell you one thing. I've had only one phone since my college days, the same phone number. Right now I am carrying 3 phones, and I make sure I do receive more than 100 calls a day on each phone, but I make sure I pick up most of them. Quite often I don't pick up, but I do call them back. So what I just meant to say is most of the doctors are trying their best to be there for you.
Right.
So take advantage of that rather than just believing some stupid thing on WhatsApp. You can just put in a message to your doctor and ask him if this is right or wrong. Yes, you
Absolutely.
need some etiquettes while you're talking to doctor. I think I'll publish a guideline of etiquettes while calling up your doctor. Don't call up any of your doctor friends to ask them कैसा चल रहा है और कहाँ चलते हैं, life क्या चल रही है. We cannot indulge in that. Don't get angry at a doctor because he could not answer your phone, forgot to wish you on your birthday or something similar because he did not do it by choice. Don't call up your doctor to ask that I need to know about my friend's health. And when the doctor says, what's wrong with his health? रुको मैं पूछ के बताता हूँ. That this is not the time. It is very clear. I have my WhatsApp message sent to everyone. If you need any help, be prepared with the name of the patient, age of the patient, the SpO2 levels, the CT score, and if the treatment is taken or not. Call me up, tell me all of this. I'll help you as much as you can. Don't call me up and keep me hanging कि रुको मैं CT देख के बताता हूँ. And last but not the least, if you are consulting a doctor, don't go for free consultation. It does not help you at all. You don't take the advice seriously when you get it for free. It's not a good thing to do because health has to be taken seriously. People are there for you, but just make sure that a professional conversation stays professional and is not taken on a lighter note. What do you say, sir, about that? People
Absolutely.
who call you 10 times in a day, send you 100 PDFs, which you go through with all pain. You have to actually read up very little text on a very limited size of the phone, and you don't expect that they should pay, but what you at least expect is they should take your advice seriously. But
that's another problem. People consult on phone, and they do not follow the advice. They say like, no,
why?
another.
Because it's a very freely available, easy advice. Correct. Something that comes very easy to me, I don't take it very seriously.
Absolutely.
It's like when you're told that you need to take a medication, you don't take it, and the moment it is out of stock, you run around the city for it and you buy it at a very high cost. So that's how people just take your advice.
Absolutely. So please provide genuine attention to these etiquette. It's very, very important that medical advice not be sought over WhatsApp. And if it is sought, then please be serious about it. And, all doctors need to be compensated for the time and then the experts, because, they have spent their youth, they have sacrificed their youth in gaining the ability what to answer, what not to answer. So, I think the stethoscope is the costliest ornament one can wear around their neck, because it costs doctors their youth. So thank you so much, Doctor. Again, a salute from all the people who are watching, to all the doctors who are doing marvelous duty. I'm sure that you have 100 patients waiting for you, exactly like 40 plus 60 beds that you are handling. I'm sure that they need your attention more. This session is going to be available on YouTube. I will post there is a YouTube channel if people are watching there, or people can watch later, by my name, Shishir Palsapure. So they can watch this session over and over again and send the link to other people who might benefit with it. Thank you so much once again, and have a wonderful evening. Good night. Bye-bye.
Stay safe. Stay safe. Everyone stay safe.